As we have reported at the top of the hour, the U.S. is shattering records for daily reported COVID-19 cases, L.A. County no exception. With more than 16,000 new cases reported today, we do, of course, want to go deeper into that story and get the latest stats.
That's right. And joining us now is L.A. County Director of Public Health, Dr. Barbara Ferrer, with some context about what's happening with this latest surge. Dr. Ferrer, thank you so much for taking the time to be with us.
No, good evening. Thanks for having me.
Well, 16,500 cases reported in L.A. County today, but should we be just hung up on just a number of new cases with so many people vaccinated and boosted? Obviously, the number of hospitalizations still lower than it was this time last year, right?
Yeah, it's a great question, Susie, and I think we should pay attention to the case numbers. Every single one of those numbers represents a person who is newly infected today, and a newly infected person, as you know, can have infected other people. So the numbers are important, and they remind all of us that we have to be super careful and super cautious. We have the most infectious strain of the virus circulating and widely circulating in our county, and we should make our decisions knowing that. So the case numbers really give us a fair amount of information about the level of community transmission and just how high it is. But I think you're absolutely right to note that if there's a silver lining here, it's that many of the people who are getting infected are in fact at this point vaccinated, and of that group, some are even vaccinated and boosted. And those folks for sure have a much lower risk of ending up in the hospital. And that will help us hopefully keep our healthcare system intact and able to serve everybody who needs healthcare over the next weeks to come.
So, Doctor, let's compare this year to last year. We had another surge last year. How is this different this time around?
It's a great question. I have a horrible feeling that our case numbers will actually be higher this year than they were last year. So, last year we topped out at about 22,000 cases in early January, and we've still got weeks to go, I think, with our case numbers potentially increasing. So we could top those numbers. But I think because we have additional tools, and the tools that we have are super powerful: vaccines, we've got boosters, and we have testing capacity, which right now it feels pretty strained, but we have way more testing capacity this year than we had last year. We know to upgrade our masks. We can use surgical masks. We don't have a supply issue on our personal protection equipment. So yes, we're in much better shape as long as we use the tools we have. I mean, that's really what we all have to do. Sure. It's not about the rules. It's not about whether there's a health officer order. It's not about what's open and what's closed this year. This year, it's about getting vaccinated, getting boosted, getting tested. If you're traveling, if you're congregating with lots of other people, if you have symptoms, keeping your mask on whenever you're around other folks, and being super careful if you don't feel well to not expose those germs to other people. So stay home when you're not feeling well. We've got these tools. We need to all commit to using them. And I think that will help us get through what is going to be a very difficult period with lots of transmission.
Dr. Ferrer, what do you think is the most important thing that the LA County is doing right now to help curb the spread of the Omicron variant?
I think making it as easy as possible for people to get vaccinated and boosted. That's still the most powerful tool we have. We have hundreds and hundreds of sites open every day. I think the only day we weren't open was Christmas Day, probably on New Year's Day, but every other day people can go all across this county, drugstores and pharmacies. We've got pop-up clinics, hundreds of them everywhere. We have community sites, we have healthcare clinics. People can go, they can get a vaccine if they need their first or second dose, and they can get boosted if they need that additional dose. And that's really the most important strategy right now. Get vaccinated, get boosted.
Yeah, Dr. Ferrer, thank you so much for your time and your availability. You've been great through all this and just being available to our viewers. And I, of course, want to wish you a happy new year. Thank you.
Yeah, same back to all of you. You guys have been awesome. So thanks a million.
Thank you so much, Dr. Ferrer.